Okay.
Knock knock.
Man,
Hi there.
hello.
Mr. Napper?
Yes.
Hey, I'm Debbie. I'll be one of the nurses helping take care of you today. Alright. So I know we've already talked a little bit before and we went over your health history as a child and your current health problems. So now what I'm going to do is basically go over you from head to toe and make sure that what you told me matches what I see.
Sure.
Sound okay?
Sounds great.
Alright, so first up, let me make sure you are who I think you are. Can you tell me your full name, please?
William Altair Napper Jr.
And your date of birth?
11/7/77.
Good. Alright, so we're going to start up top. Okay. And I remember you telling me that you have a history of psoriasis.
Yes.
Right. And mostly like in your hair, right in the hairline.
Yes.
Okay. I see a little bit of irritation. Nothing too bad though. Is there anything you take for that or do for that?
No, I tried a few things, prescriptions from the VA, and they never worked. So I just kind of bounced from dandruff shampoo to dandruff shampoo.
Okay. Looks pretty good right now though.
Yeah.
Sorry. There you go. Okay. Let's see. Maybe a little bit on your face?
Yeah.
Okay.
The face is almost constant.
Gotcha. Okay, so that doesn't really go away.
Not really.
Okay. I'm sorry to hear that. Alright, and let's see. Any other skin problems that you know of? Does the psoriasis show up anywhere else? Like in your joints?
Sometimes on my elbows, but
Okay, gotcha. No problems with your nails, anything like that? Good. Good. Wonderful. Okay, so no lumps on the head that I see. Good. Eyes are nice and symmetrical. Okay. I'm gonna just take a kind of poke around at your face here for a minute.
sure.
I like my pen light. You'll find I use it a lot. Okay. Eyes are nice and round. Open up real big for me. Good. And nose looks good. No surprises in there. I do remember you also mentioning that you have problems with earwax buildup.
Yes.
You ever seen an ear, nose, or throat doctor? Or do any drops or anything like that for it?
Not for that problem specifically.
Okay, fair enough. Open up, say ah. Good. Any teeth issues? Go ahead.
Just nothing out of the ordinary.
Okay. And I do remember seeing that you had not been to the dentist in a while. Do we need to get you a referral for a dentist, maybe?
Sure.
Okay, gotcha. So, I'm just going to push around here a little bit. Okay. Tighten your jaw up for me. Any soreness right in there in that joint?
No.
Good. All right. And I'm going to feel around right in here for your lymph nodes. And this is actually one spot where I shouldn't really feel anything. Let me know if there's any tenderness or anything going on there, okay?
That's good.
Feel okay? Okay, we're gonna come right down here. Come right above the bone. Good. All right, good. Okay, let's see. So, the other thing that I need to do is just check out your sinuses real quick. You ever get sinus headaches right up here?
On occasion.
How about down here?
Yeah, rarely.
Tender or sore at all as I'm touching?
No, not right now.
Okay, good. It's nice and symmetrical. All right, so next thing we're going to do is I'm going to take a look at your chest and listen to your lungs and your heart. So, yeah, take a good few deep breaths for me. Good. Okay. Lower muscles, use those ab muscles. There we go. All right. And I do remember you mentioning that you had scoliosis as a child. Is that accurate?
Yes.
Okay. So your clavicles are good. Any tenderness in the ribs?
No.
Good. Prior broken ribs, I heard. We don't know how it happened. Popped up on the X-ray.
Too many bar fights in the Marines.
There we go. Nothing recent though.
No, not in the last 20 years.
All right, good. I'm gonna take a look at your spine here and check out your spine and your ribs. Any treatment of any type for the scoliosis?
No, they caught it too late.
Okay. Any tenderness
No.
here in your spine as I go down?
No.
Still good?
Mm-hmm.
Okay, good. Still good?
Yep.
All right, good. All right, I'm going to go ahead and listen to your lungs. breaths for me. Good. And I also remember you haven't had a history of kidney stones, right?
Yes.
Good. Any tenderness here over the kidneys?
Not right now.
Good. All right. Okay, so I'm gonna come back up front. Excuse me. And I'm gonna listen to you breathe again, and I'm gonna take a listen to your heart. Okay. Good. Deep breaths. Okay. I'm gonna listen to your heart, so you can just breathe normal. And no cardiac history that you know of, right?
No.
I'm just gonna flip this over and do the exact same thing. You'd be surprised how different it sounds. Making sure you don't have any extra heart sounds that probably shouldn't be there. Good. Okay. So now, one more thing I need to pop back around to the back into you. Kind of an odd thing. I'm going to lay my hand on your back, and then I need you to say the word 99.
99.
Good. Again.
99.
Again.
99. 99.
Good. All right. There's good vibration in there. I wonder if that qualifies as vibrato. Okay, so the next thing I'm going to do actually is I'm going to finish assessing your chest, and then I need to take a look at your belly. So can you go ahead and lay flat for me?
Sure.
Okay. Yeah, put your shirt up a little bit and just take a look. So just, yeah. Nice down. Good. Alright, everything looks nice and normal there. So, next thing I'm going to do is real quick just make sure our pulses here in your neck are good and I can feel both sides. It's one of those things you can't take a pulse on both sides of the neck at once. Don't want to do that. Take a listen real quick, make sure we got good blood movement there. Good. Okay. And I'm gonna real quick just take a listen to your belly. Oh, okay, yeah. Nice and bubbly.
I just had dinner a little bit ago.
Good. Okay. And listen right here. Good. All right. Whatever you got in there, it's working.
Chili.
All right, now we're gonna do a little thing called percussion and see if you sound hollow.
Okay.
Good. All right, everything sounds good to me. And then I'm just gonna dig in a little bit and feel around. Make sure I can't feel anything in there, especially over that liver. So I understand we had quite the alcohol intake there in youth.
Yeah, I was drunk more than I was sober. So.
Okay, good. Any tenderness anywhere?
No.
Yeah, Nothing sore to the touch?
No.
Okay, good. Now I'm going to give another feel up here, up under your kidneys, just to make sure. No tenderness there?
No.
Good, no tenderness there. All right, and then actually I'm going to go ahead and have you go ahead and sit back up.
Okay.
If you want to sit in the chair, it might be easier for you right now.
All right.
Okay. All right, so now I'm going to do basically what amounts to a neuro check. These look a little bit different from my habits just because I worked in a neuro facility for so long. I tend to do these a little bit differently from most people, so it might be a little odd.
Sure.
But the first thing is pretty standard. I'm going to get you to close your eyes for me and tell me what you smell. Keep your eyes closed now.
Like cinnamon.
Good, it's a cinnamon stick. Okay. All right.
I smell Christmas.
Yeah, right. All right. At this point, if I had an eye chart, I would be doing a Snellen eye test. But I don't have an eye chart, so we're going to pretend that we've done a visual acuity test. I can go ahead and tell you for this particular patient, it would not be good news, especially without his glasses on. But this is where I would address the Rosenbaum eye chart. Okay. And also, I do not have an ophthalmoscope, so I cannot do the red eye check. If I had an ophthalmoscope, I would be looking for the red eye reflex. So, all right, so the next thing we're going to do then is your pupillary reactions. And for this, I'm going to turn our lights down. Okay. All right, I want you to look right at my nose. Open your eyes big. Good. Good. All right. Now, look at the pen light. Keep your eyes on it. Good. All right. And the next thing we're going to do is I want you to keep your face towards mine, but follow the pen light. Okay? Good. Wonderful. All right. Now, the next thing I need to know is how well you can hear. So, can you hear the click?
Yes. Yes.
Okay. How about just a little motion?
Yes.
Okay.
Yes.
Good. Wonderful job. And at this point, if I had a tuning fork, I would be doing the tuning fork test to the top of the head. Also a piece of equipment that unfortunately I do not have in my home. Okay, so the next thing I want to do is take a look inside your mouth and just make sure everything there looks good. Okay. Say ah. Good. Press down. Good. All right. Okay. Now we're going to do a sensation test.
Okay.
And this is part of where I do things a little bit differently. I go head to toe on the sensation test.
Okay.
So, all right, first up, tell me where you feel it, right or left?
Left. Right. Left.
Okay, good.
Left. 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 Right. Right. Right.
Okay, stay right there. Keep your eyes closed. And tell me if anything changes.
It's pointy.
Good. All right. And I'm going to also go down here and check your notes. Okay. Good. All right. Now tell me pointy or soft.
Soft. Soft. Soft. Pointy.
All right. Very good. Okay. So good. And next, I'm going to get you to just clench your jaw for me. Okay. Don't let me open it. Good. Close your eyes tight for me. Don't let me open them. Good. All right. Now, real quick, we're going to do some facial expressions. Okay. As raise your eyebrows. Good. Smile for me real big. Stick your tongue out. You stick it up. Good. All right. Wonderful. And then we're going to test a little bit your musculature in your neck. Push against my hand. Good. Other side. Good. Don't let me push your shoulders down. Shrug up. There you go. Good job. All right. And the last little bit of it is just making sure you know a little bit more about what's going on in the world. You already gave me your name and your date of birth. Do you know what today's date is?
No.
Can you tell me?
November 16.
Close, fair enough. Can you tell me what day of the week it is?
Tuesday.
Caught you by surprise. Happens to me too. Where are we right now?
In the house.
Okay. What town?
Summerfield.
County.
Guilford.
State.
North Carolina.
Who's the president?
Trump.
Who's the president-elect?
Biden.
Very good. I like that answer. All right. So, next thing we're going to do is a little bit of coordination movement. Lay your hands flat for me. Okay. And flip them over. Nice and easy for a little bit. Now see how fast you can go. Can you get them going? Good. All right. Now we're going to do some finger touches. Finger to thumb. Finger to thumb. Get them going there. Good. All right. And the last thing is, I want you to take your right hand, put your finger on your nose, touch my finger. Keep looking at me. Good. Nose, finger. Good. Keep going. Now switch hands. Okay. There you go. That's it. You got it. All right, good. Now look right at my face. I'm going to test your peripheral vision. Tell me when my fingers disappear.
Not there.
Okay, you don't have to look like you want to kill me. It's all good.
Concentrating.
Right.
Concentrating.
All right, now I'm going to take a look at your arms and your legs. You can put your vest back on. That's fine.
Concentration, please.
All right, so this is also part of the standard stroke screen. We're just going to work some other things in, okay? All right, so first, give me a grip, both hands, hard as you can. Good. All right, pull me to you. Good. Push me away. All right, good job. All right, and now can you just give me a range of motion in your arm? If you need to stand and do your other side, that's fine. I don't want you to wrap your arm on the table. Okay, good. All right. And now I'm going to check your pulses real quick. We're just going to do your pulses right here, the radial pulse. Good, because we know if your peripheral pulses are intact, then your central pulses have to be intact. And at this point, if I had a reflex hammer, I would be checking the brachioradialis reflex and the biceps and triceps reflex, but I do not have a reflex hammer. So we'll have to just say that we did that, unfortunately. All right, so next, sit back down in the chair for me. Okay, good. Actually, I lied. Stand up and do a squat for me. I forgot you can squat. Yep, give me a full squat. Let me see your leg strength. Good job. And I would also be checking the patellar and Achilles reflex if I had a reflex hammer at this point, which unfortunately I do not. All right, and I am, though, able to check your Babinski reflex because you don't necessarily have to have a hammer for that one. So let me borrow your foot. I'm going to check it over. Sit. Make life easy. All right, good. Now, sorry, I know you're ticklish, but you do not have a Babinski reflex, which is a good thing. Your pulses are really high up. There we go. All right, good. Toes, nails, everything looks good. Well, let's get this one real quick. No swelling. And then, sorry, here comes another one. I didn't know better. I'd say that looks like a Babinski, but I know you're just ticklish.
Very ticklish.
All right, there we go. Nails look good. Everything on your feet looks good. All right. And then we've got a few like balance style tests. Stand up for me. Okay. And I know I watched you walk in, so I know that your regular gait is good. I know that you used to be an officer. Let's see that heel toe walk, officer.
It's not as good as it used to be.
All right. Go back to your chair. Good. And now one more balance test. Hold up.
Yep.
One more balance test. Yeah. Put your feet closer together. Okay. And just hold your arms up for me. Okay. Now close your eyes. And we'll see how well you balance. Yeah, very good. All right. Okay. And the only other thing I have is you can sit back down for me if you want. I've got one more touch test. Hold a hand out. Doesn't matter which one. And tell me what object is in your hand, please.
Key.
Okay. Very good. All right. I think I've been all over you. Is there anything else that you can think of that you needed to know about, or anything that we missed in your history? Anything you can think of?
No.
Over to you.
Yeah.
All right, great. Thank you.
Thank you.